Welcome to 12 to Your Health. I'm Dr. Derek DeSilva. Medical advancements are now making what seemed impossible possible. Today we've got Neurosurgeon Dr. Kevin Yao from Metropolitan Neurosurgery Associates in Jersey City and Inglewood here. He's performed brain surgery, you ready for this, on someone who was awake and talking while it happened. Awake and talking during brain surgery? How did that work?
Well, in certain circumstances, it's actually safer to do these kind of surgeries in patients when they're awake, just so that we can monitor their neurologic function. In other words, how their brain is working during the surgery, and the only way to do that is with them awake.
So, is it no anesthesia? Do you use hypnosis or acupuncture? I mean, what is it that you do?
We actually use anesthesia, but only during the beginning and end of the surgery. But during the most critical portion of the surgery, when we're actually taking out the tumor and taking tumor out from very, very critically functional areas of the brain, then essentially there's minimal anesthesia at all, so the patient really is awake.
And we've got some video, and I'd like you to just comment on this very briefly. Yes. Oh, here's the video, and this is obviously the operating room, and I think at some point is she talking?
She's talking, she's interacting with us, we're making sure she's comfortable, and most importantly, we're monitoring the function that we're really following most closely. In other words, in this situation, the tumor was located in the part of the brain that controls her left leg and foot. And so intermittently during the surgery, in addition to talking to us, we have her moving her foot and leg so that we can really in real time monitor how that function is working.
That is absolutely fabulous. So it's not for every neurosurgical procedure, right?
That's
it's
right.
Not for every brain surgery. There are specific, can you get a little bit more specific as to what type or where?
Yes. So there's certain functions that we can monitor very well during the surgeries, and when we're taking out tumors in parts of the brain that control movement and or speech, those are typically patients who may be candidates for awake surgery. But not all patients can tolerate this, so right. It's a very careful selection process.
How long was this procedure, by the way?
The surgery itself was about 3 hours.
And then her time of anesthesia, pre and in the beginning, at the end, how long?
About 45 minutes on each end of the surgery.
Wow.
Yeah.
And obviously she did well through the procedure?
She's done great. She's done great. The surgery turned out very well. We were able to take out the tumor, and everything went perfectly well.
Super. Well, thank you so much for joining us. Keep up the great work.
Thank you.
Pleasure to have you here. Welcome to 12 to Your Health. I'm Dr. Derek DeSilva. Last week we addressed awake brain surgery, a method that involves a patient being awake during a procedure, a surgical procedure. We talked with Neurosurgeon Dr. Kevin Yao from Metropolitan Neurosurgery Associates in Jersey City and Inglewood. He's here to join us again today. And also, we are joined by the patient, Lee Davidson, who underwent this groundbreaking surgery. Thank you very much for joining us today.
Of course.
So, when I heard that we were going to do this interview segment, I thought, how do you do brain surgery on somebody who's awake? Tell me a little bit about that experience that you underwent.
Well, actually being awake, the experience was actually quite positive. I was prepped really well for it. I had a great relationship with Dr. Yao beforehand, and I had a strong relationship with the anesthesiologist that was going to be with me as well. So it was a comforting experience, actually.
How were you prepped?
I actually sat down with the anesthesiologist and had about a half-an-hour interview or consultation, get to know each other sort of dialogue between she and I. And then Dr. Yao and I had some pretty in-depth conversations about it as well, answered all my questions and just really put me much more at ease.
So Dr. Yao, what did those conversations involve with her?
Specifically about the surgery, I just wanted to make Lee as comfortable as possible so that she would know what to expect from the very beginning all the way until the end, so that she wouldn't be surprised or shocked by her surroundings.
Now, we have some video that I'd like both of you to comment on, and I don't know, have you seen this video before?
I have.
Okay. When you look at a video like this, what does that feel like? You know, here it is, right here.
It was a very surreal experience
Yeah.
to see something of this capacity being done. Part of the being awake, I remember. Part of it, I don't. So
Probably a good thing.
It was, yeah, it might be a good thing.
Yeah.
But everything was very comfortable, and it was very reassuring to me to be able to have people that I feel like cared about me, and that I know cared about me from my experiences leading up to the surgery, be there by my side and really take me through it.
And Dr. Yao, what kind of a procedure was this? What did she have?
She had a craniotomy, which means opening the skull, and then we did awake cortical mapping, in other words, to map out where the function is along the brain, and then we took out the tumor that was affecting her brain.
And getting through the surgery, everything was fine. You know, you were dancing before you came on the set, so obviously you're doing well.
I am doing very well.
And the recovery, what was the recovery like?
The recovery was actually pretty good. I spent 2 weeks in the hospital after that. I moved on to outpatient physical therapy twice a week, and I went back to work last week full time. No restrictions.
How often are we doing this? By the way, this happened in September.
Yes.
Okay. How often are we doing these type of procedures?
We're doing them whenever we need to. In other words, if patients have tumors in critically located parts of the brain, then we do these.
And I thank you both for being here. And way to go.
Thank you.
Okay, stay there. Don't start dancing off the set
Don't
yet.
worry.
Okay. All right. Very good. Thanks again for joining us. And folks, here's a look at what's coming up tomorrow. Remember, you can catch 12T Health every Saturday and Sunday at 15 minutes past the hour, starting at 6 a.m.